no quality of life for people like us.
Right now on CBS 4 News at 11 o'clock, a problem solvers investigation uncovers a new problem inside the Marion VA hospital.
The same doctors once investigated for giving out too many opiates, now accused of going too far to correct their mistakes. Veterans reached out to CBS 4 by the dozens after our last investigation aired in October. They say their prescriptions had been abruptly cut off.
CBS 4's Deanna Albritton took their complaints to top staff at the VA. She joins us now with what her investigation found. Deanna.
Debbie, it's been a long few months, and these veterans, over that time, they have told me that their opiate prescriptions were cut off with no warning and no communication from doctors at the Marion VA. 3 of them sat down with me. They called the VA's response to the opioid abuse epidemic irresponsible and dangerous.
My name is Josh Keller. I was in the United States Army as a medic.
Rayanne Panther, I was Air Force law enforcement K-9.
My name is John Nelson. I was in the United States Air Force.
3 veterans, 3 generations, 1 accusation.
They're treating us like we're addicts, selling our prescriptions on the street.
None of us want the drugs for high. We just want to live again.
They're all patients at the Marion VA hospital, left to struggle with pain and withdrawal symptoms after they say their prescription pain medications were suddenly cut off. Daily doses of OxyContin, Lortab, and Tramadol now gone.
So I called back several times, finally got a nurse to say, they are not giving you your medication. I am extremely sorry. And she was very upset on the line and sounded like she was in tears and said, you know, they've done it to not just you, but everybody. They've done this to everybody.
No plan of action. Cut you off, never talk with you about
Never
it.
got a warning.
They say the cutoffs came just a few days before their prescriptions ran out. No help tapering off the heavy-duty narcotics and no relief for chronic back and knee pain they spent years trying to leave behind.
You know, I can't weigh my options. Well, am I going to be sick? Can I call in sick today, or is it going to be worse tomorrow?
There's no quality of life for people like us. When they say your pain level from 1 to 10, dear God, what's a 1? We live probably at a 4.
They claim the doctors not only brushed off their concerns, but were quick to point the finger at one doctor they say is making those cutoff decisions. The person who's telling them this is the way you have to do things, you're all hearing the same.
Dr. Drum.
Dr. Drum.
Dr. Lori Drum is not these veterans' primary physician. In fact, they say she never treated them at all.
Dr. Drum is a very experienced primary care provider, and she is our service chief for the primary care service line.
Dr. Drum wouldn't speak with us, but her boss, Chief of Staff Dr. Wayne McBride, did. He says part of Dr. Drum's job is to recommend changes to prescriptions when a veteran has violated their pain contract by not taking opiates properly, or when she believes the prescribed dose is too high.
There have been times, I believe, when some of the providers or physicians have sought her assistance, and she has then indicated to them a certain course of action.
Why are they getting communication that she's made the decision and not necessarily their primary care provider?
I'm concerned when the veteran has not received the communication from the assigned provider, and Dr. Drum is scripting this care or making those determinations.
With Rayanne's permission, we showed Dr. McBride 2 My Healthy Vet messages from the times doctors said they were taking her Tramadol away. In June of last year, a nurse tells Rayanne Dr. Drum is not going to order additional opiates, and Dr. Drum is concerned about unintentional overdose. A shocked Rayanne states she has never been seen by Dr. Drum.
I think in this particular case, she was covering for another provider, but still, as I've acknowledged, I think it could have been handled better.
After having the prescription renewed in October, her nurse practitioner tries to abruptly cut her off again.
I was told on Saturday that nurse practitioner Hall will not read my fill. It's disturbing that she wouldn't say, come in, let's talk about this. I don't think you need this. Why? And have a conversation. So it's concerning.
Dr. McBride says his intent is for opiate reductions at the Marion VA hospital to comply with the National VA's Opioid Safety Initiative.
In many chronic pain conditions, opioid medications are now not thought to be the standard of care.
Dr. McBride told me veterans are supposed to be offered other forms of pain management, a chiropractor, physical therapist, acupuncturist, even a psychiatrist, as they're slowly taking off opiates. But that doesn't match the accounts from these 3 veterans or the many others.
I've spent almost $1,200 of my own money using a doctor for acupuncture and chiropractics. We ask them about it and they'll say, well, no, you don't need that. I've had a doctor say to me, I don't believe in that stuff.
Exactly.
I will believe in anything that helps me.
McBride admitted alternative pain care appointments aren't always available quickly. He also acknowledged that some doctors haven't been following orders to carefully wean veterans off their opiates.
We have had accounts that have arisen in our healthcare system where veterans have been removed from their opioid medications, perhaps a little bit aggressively.
Rayanne and Josh weren't told until they requested their refills. John says he didn't know until he went to the pharmacy window. Dr. McBride believes fear may be motivating some providers to move too swiftly.
Concern is growing that they may be subject to a review, or their license, if they're giving too many opioids, may be in some jeopardy.
In turn, though, the veterans I spoke with feel those primary care providers are putting their and other veterans' lives in jeopardy instead.
That's why there's 22 veterans committing suicide every single day. Chronic pain is a killer. And in my opinion, these programs where they're just abruptly taking medication from patients that absolutely need it, this is the cause.
One of the last things you heard Dr. McBride say there was about the pressure these doctors are feeling to cut down their prescriptions of opiates. We took the issue to Indiana Representative Jackie Walorski, who actually wrote a new law forcing VA providers to stop overprescribing and holding them accountable. Her office, though, says the law clearly requires safe removal from those opiates when they do.
So many veterans reached out to us, and not just from the northern Indiana VA.
No, that's where a lot of them came from, but we had people calling us from Indianapolis, from Tennessee, even as far away from California and from Washington. So this is something that her office, Congresswoman Walorski's office, is going to look into to make sure this isn't a nationwide problem.
Yeah, it should be managed properly, and it can be. So I know you're going to keep track of this for us.
Definitely.
Deanna, thank you very much.
So I think that kind of legislation helps to make the VA a more accountable, more streamlined organization.
Right now on CBS 4 News at 11, holding VA employees accountable for the treatment of our veterans. Good evening, everyone. Thanks for joining us. I'm Bob Donaldson.
And I'm Aisha Hasney in for Debbie tonight. Just last month, the CBS 4 Problem Solvers investigation uncovered veterans abruptly cut off from their opioid treatments at the VA hospital in Marion.
None of us want the drugs that for the high. We just want to live again.
That is Ray Ann Panther. She's one of the veterans who says she's been taken off her pain pills without an alternative solution.
This week, the U.S. House is expected to pass a measure that would make it easier to fire or discipline VA employees who don't put their patients first. That could include doctors who don't follow strict guidelines for weaning veterans off addictive opiates. CBS 4's Deanna Albritton has more on those potential changes and a major new update in her investigation. Deanna.
Yes, Bob, because we now know with a copy of a report that I have obtained from Capitol Hill that the Peru VA clinic also had these same issues too, and lawmakers are asking the VA to respond to these allegations. They are now concerned that this problem could be more widespread than just the Northern Indiana VA system.
We began to focus on the fact that we didn't want anybody to ever have any pain. Now we are on 180 degrees from that.
Today, Indianapolis VA Director Brian Hancock reconfirmed the VA's commitment to look for ways to write fewer scripts for opiates. Veterans I spoke with, though, say in an effort to reduce the number of addictive pain pills, VA providers are cutting off some patients too quickly, which I confirmed is happening at the Marion VA.
I told them in a healthy vet text, if you want to take me off this drug, fine. Let's talk about alternatives. I'm willing to come off of the tramadol, but give me something that's going to help me.
Across the country, VA doctors and nurses are supposed to make sure other forms of pain management are available before taking veterans off their opiates.
We have some relatively strong guidelines about how we can begin to reduce things. For some veterans, that may be a little bit too fast.
Dr. Hancock says doctors at Raudebusch, the Indy facility, should be taking concerns seriously, not using a one-size-fits-all formula to get people off these medications.
We're always willing to listen.
But a Veterans Health Administration investigation showed doctors at the Peru clinic aren't always listening, and our investigation into the Marion VA showed the same. Now lawmakers who are still waiting for answers about overprescribing say their questions whether abrupt prescription cutoffs are putting veterans in danger have been met with silence too.
I would have liked to have gotten them right away. They know how to get a hold of me. All they have to do is call the staff. All they have to do is call a team. And so we're working right now on trying to get those answers.
Another Indiana congressperson is also involved in all of this. Representative Jackie Walorski, I spoke with her just about an hour ago. She says that the VA missed a June 2nd deadline, the Northern Indiana VA system did, to answer these questions about these abrupt cutoffs and making sure that they aren't having any continued issues with overprescribing. She says they're going to keep hounding them until they get some answers, because she says right now what they have is just not sufficient to know whether this problem is truly more widespread. Live downtown, Deanna Albritton, CBS 4 News.